Safety is online, limit or communication embedded in a vascular procedure or in window samples like tick, etc. Logical structure of the test consists of the following is one, the capsule and septa tunica vaginalis, the outermost serous layer, an extension of the peritoneal cavity, tunica albuginea, a thick fibrous connective tissue capsule. It projects inward as septa, dividing the testis into roughly two steep pyramidal compartments, lobules. Tunica vasculosa, a delicate, highly vascular layer lining the inner surface of the tunica albuginea. Seminiferous tubules. Each tubule contains 1 to 4 highly coiled seminiferous tubules. These are the actual sites of sperm production and are lined by a specialized germinal epithelium. This epithelium contains two main types of cells, spermatogenic cells, germ cells in various stages of development. They mature and migrate from the outer basement membrane toward the central lumen. They progress from spermatogonia, primary spermatocytes, and mature spermatozoa. Interstitium. The connective tissue spaces located between the highly coiled seminiferous tubules. This area contains Leydig cells, large eosinophilic endocrine cells that synthesize and secrete testosterone, blood vessels and lymphatics, a rich capillary network to support metabolic needs and transport hormones into systemic circulation. Excurrent ducts. The sperm exit the seminiferous tubules through a network of connecting passageways in a specific order. Tubuli recti, straight tubules, connect the seminiferous tubules to the central network. Rete testis, a branching labyrinthine network of channels lined by simple cuboidal epithelium. Efferent ductus, connect the rete testis to the epididymis. Epididymis, a highly coiled tube where sperm are stored and mature. Seminiferous tubules. Seminiferous tubules are the highly coiled functional units of the testis, lined by a specialized stratified germinal epithelium. This epithelium is supported by a basement membrane and houses two primary populations, sperm-producing germ cells and supportive secretory cells, all wrapped by contractile myoid cells. The tubule, wall, and boundary. Myoid cells, peritubular cells, flattened, smooth muscle-like cells that surround the tubule. They use peristaltic contractions to propel maturing sperm and fluid toward the testis. Basal membrane, a thin extracellular layer that structurally supports the germinal epithelium. Seminiferous epithelium. The inner lining contains two distinct types of cells responsible for the maintenance and production of sperm. Receptory cells, nerves or sustentacular cells, appearance large columnar cells that span the entire thickness of the epithelium, resting on the basal membrane and reaching the lumen. They have a pale oval nucleus with a very prominent nucleus. Function: they nourish, protect, and regulate developing sperm cells. They also secrete testicular fluid and androgen binding protein to concentrate testosterone in the lumen. Blood test barrier. Adjacent secretory cells are bound by tight junctions, dividing the tubule into basal and luminal compartments to protect developing meiotic cells from the body's immune system. Spermatogenic cells or germ cells. These cells undergo progressive development, that is spermatogenesis, from the base of the tubule to the lumen. Spermatogonia. Diploid stem cells resting directly on the basal membrane. They constantly divide to maintain the sperm cell core. or differentiate to form sperm. Primary spermatocytes, the largest stem cells which cross the Sertoli barrier and enter meiosis. Secondary spermatocytes, the products of meiosis, they are very rarely seen in histological sections because they quickly divide. Spermatids, small round cells closer to the lumen. Later in development, that is spermiogenesis, they elongate and shed excess cytoplasm. Spermatozoa or sperm, fully mature sperm with condensed elongated heads and flagellar tails, frequently observed in the center of the tubule lumen just prior to release. The interstitial surrounding tissue. Between the tightly packed tubules is the interstitial space, which features a loose, vascularized connective tissue containing Leydig cells, that is interstitial cells, distinct polygonal cells with eosinophilic cytoplasm and lipid droplets. They synthesize and secrete testosterone in response to the luteinizing hormone. Pause difference histology. The vas deferens is a thick-walled fibromuscular tube that transports sperm from the epididymis to the ejaculatory duct. Its wall has the highest muscle-to-lumen ratio of any hollow organ, making it highly durable for peristaltic contractions during ejaculation. The wall is organized into three distinct histological layers. Mucosa, innermost layer, epithelium, lined by a pseudostratified columnar epithelium consisting mainly of tall principal cells with long stereocilia or for fluid absorption and small round basal cells. Lamina propria, composed of connective tissue rich in elastic fibers. Lumen, thrown into complex prominent longitudinal folds which give the lumen a distinct stellate or star-shaped appearance in the cross section. Muscularis, middle layer, smooth muscle, exceptionally thick and organized into three distinct layers of smooth muscle: inner longitudinal, middle circular, outer longitudinal. Function is these robust layers produce powerful peristaltic waves to propel sperm. Adventitia, outer layer, connective tissue, the outer fibroelastic core that blends with surrounding tissues, contains houses blood vessels, example differential artery, and nerves that supply the duct. Vast difference. Seminal. Seminal vesicles are a pair of accessory glands in the male reproductive system located between the bladder and the rectum. They produce a thick alkaline fructose-rich fluid that makes up 50% to 80% of semen. The fluid nourishes sperm cells and helps them survive in the acid environment of the female reproductive tract. Anatomy and location. Location positioned at the base of the bladder, just behind the prostate and in front of the rectum. Structure, they are called pouch-like tubes, roughly 3 to 5 centimeters long, though they would measure 10 to 50 centimeters if fully unraveled. Duct system, each gland merges with the vas deferens to create an ejaculatory duct. These ducts pass through the prostate and empty into the urethra. Seminal vesicles. Prostate. The prostate is a compound tubulo-alveolar gland composed primarily of glandular epithelium and fibromuscular stroma. Its tissue is organized into three distinct glandular zones: peripheral, central, and transition, which dictate how it responds to diseases such as cancer and benign prostatic hyperplasia. Key components: glandular epithelium consists of 30 to 50 branch tubuloalveolar glands lined by a distinct bilayer of cells. Luminal cells, a layer of tall, simple columnar or pseudostratified cells responsible for secreting prostatic fluid containing PSA and zinc. Basal cells, a discontinuous layer of small cuboidal stem cells that rest on the basement membrane. Fibromuscular from accounts for up to half of the prostate's total volume, consisting of dense, irregular connective tissue, elastin, and interlaced smooth muscle bundles. These muscle fibers contract during ejaculation to push secretions into the urethra. Corpora amyloacea. Concentric laminated correct concretions of prostatic secretions frequently found in the glandular lamens of older men. Microscopic identification checklist. When examining a normal histological section, hematoxylin exams stain of the prostate, look for irregularly branching or undulating glands. The classic two-cell layer, inner tall secretory columnar and outer low cuboidal. Prominent smooth muscle fibers surrounding the glands. Prostate. Penis histology. From a histological perspective, the penis is characterized by three cylindrical masses of erectile tissue bound together by a dense fibroelastic capsule. Under a microscope, a standard transverse cross-section reveals two paired dorsal columns called the corpora cavernosa and a single ventral column called the corpus spongiosum, which encloses the penile urethra. The three main erectile bodies. The core structure of the organ is formed by these specialized vascular cylinders. Corpora cavernosum, a pair of vascular channels located on the dorsal side. They contain an intricate maze of interconnected vascular sinuses, cavernous spaces lined with endothelial cells. The intervening walls or trabeculae consist of collagenous connective tissue, elastic fibers, and high concentration of smooth muscle cells. Corpus spongiosum. This single mass sits mid-ventrally, while its internal layout of blood sinuses and trabeculae is similar to the corpora cavernosa. It remains more compressible. As distal end, at its distal end, it expands outward from the glans penis. Face, facial layers and envelopes. Progressing from the inside out, the cylinders are organized by distinct facial boundaries. Tunica albuginea is a thick, highly durable sheet of dense, irregular connective tissue. It surrounds the corpora cavernosa, a thick, bilayer structure to withstand high pressures during erection. Notably, the tunica albuginea encircling the ventral corpus spongiosum is much thinner and more elastic. This structural difference prevents the urethra from being squeezed shut when the penis becomes erect. Pectiniform septum, a wall of dense regular connective tissue that separates the two corpora cavernosa. It is often incomplete or perforated in humans. Deep penile fascia, like Buck's fascia, a tough, deep layer of fibroelastic tissue immediately superficial to the tunica albuginea. It bundles all the three erectile cylinders together into a single unit. Superficial fascia, dartus layer, and skin. Positioned between Buck's fascia and the outer skin is a layer of loose elastic connective tissue. It contains smooth muscle, dartos, and lax adipose tissue. It allows the thin layer of the thin outer skin to slide smoothly over the shaft. Penis histology. So today we have discussed the histology of male reproductory system. Thank you for patient hearing.